Have you ever wondered why some guys get man boobs or gynecomastia? Let's explore the science behind it, debunk myths, and find out what you need to know about this common condition. Gynecomastia is a non-harmful condition where male breasts enlarge due to increased glandular tissue and fat. It can cause physical discomfort and affect self-confidence. In overweight men, there is a similar appearance due to fat alone called pseudogynecomastia, which is different from what you're talking about. Additionally, temporary breast enlargement in newborns is unrelated and shouldn't be confused with gynecomastia. Men can experience breast tissue growth at any age, either on one side or both. During teenage years, about 30 to 60% of boys may have this, and around one-third of adult men might also be affected. The numbers vary based on how experts define and study this condition. Gynecomastia is most common in older men, affecting up to 65% of them. While it's a common issue, there is still a lot we don't know about how often it happens nowadays. Some think it might be increasing, possibly due to things like steroid use or exposure to substances that act like estrogen. In men, their breast tissue has receptors for both estrogen and androgen hormones. Estrogen tends to make the ducts in the breast grow, while androgens do the opposite. They slow down this growth. When there is an imbalance between these hormones, that's where gynecomastia can happen. This imbalance might occur because of various reasons like higher estrogen levels, either produced in the body or from outside sources like certain drugs or chemicals, or lower levels of androgens. This hormonal mix-up could be due to different factors like how these hormones bind or act in the body, or even some issues with the receptors themselves. In guys, the testicles make most of the testosterone, a bit of estradiol, and a small amount of another estrogen called estrone every day. Normally, men don't have a lot of estrogen in their blood, but around 80% of estrogen in guys comes from changing other substances like androstenedione and testosterone into estrone and estradiol. This change happens in places like body fat, the liver, skin muscles, and kidneys. As men get older, or if they have more body fat, this process of turning these substances into estrogen increases. There is evidence that enlarged male breasts can have hormonal connections. Some cases involve receptors of hormones like luteinizing hormone and human chorionic gonadotropin. These receptors might affect local metabolism and reduce androgenic effects. Additionally, factors like elevated serum progesterone, hyperprolactinemia, which is increased prolactin hormone, and potential crosstalk between hormones may play roles in the development of this condition. However, not all men with enlarged breasts show these hormonal changes. Gynecomastia can have various causes, and many factors may be linked to it. Some of them are normal body changes, others have no clear reason, others are breast growth caused by medication. Other less common causes include liver issues, hormonal imbalances, testicular tumors, thyroid problems, and kidney disease. Gynecomastia can vary in how it looks, from just a bit of swelling around the nipple to breasts that resemble a female's. The main signs are swollen breast, large nipples, a different fold under the breast, drooping of the gland, and extra skin. Doctors have different ways to classify these appearances. One method divides gynecomastia into 4 grades based on how severe it is. Grade 1 is minor, mainly affecting the nipple area. Grade 2 involves most breast tissue with nipple still above a specific fold. Grade 3 is significant breast growth, some drooping and the nipple at or slightly below the fold. Grade 4 is the most severe with lots of breast tissue, sagging and the nipple well below the fold. If gynecomastia is mild and doesn't cause significant emotional distress, and tests show no underlying health issue except for weight gain, doctors may recommend reassurance and regular checkups every 3 to 6 months. Reassurance is often seen as the safest approach since gynecomastia is usually temporary and doesn't cause symptoms. For teenagers with mild breast enlargement, a simple approach involves explaining their hormonal changes during puberty and assuring them it's a common temporary condition with no lasting impact on sexuality or fertility. In cases where excess fat contributes, especially in overweight boys, a weight loss program involving diet and exercise is recommended as the first step. If medications or anabolic agents are causing gynecomastia, stopping them may lead to improvement. If gynecomastia persists, become more severe and causes pain or emotional distress, then medications or surgery might be considered, especially if the patient desires treatment. If you found this information helpful, don't forget to give it a thumbs up, share it with others, and subscribe for more valuable content. Your support helps me to spread awareness. Thank you for being part of this community.